Welcome to the Exam Room Podcast, brought to you by the Physicians Committee. Hello, I'm the weight loss champion, Chuck Carroll. Thank you so very much for watching and downloading in more than 150 countries around the world and making the Exam Room one of the most consumed nutrition podcasts anywhere on the planet today. And on this day, our focus is on something called LP little a, or lipoprotein A. What is it? Who's at risk? How is it affecting your health? Well, we're going to speak with a gentleman who knows about this all too well. He is a doctor who is a heart attack survivor and has one heck of a story to share. And we thought that all of the chapters in his book had been written, but not so fast, my friend, because now he is on a journey to talk more about what LP little a actually is and how it affects your health. With that, we welcome Dr. Akil Taher to the show. Thank you so very much for being here, my friend.
Thank you for having me, Chuck. It's always a pleasure to be here. I think the last I was here was 3 years back in June of 2023. I'm so happy to be back again.
And yeah, we were talking about your book, Open Heart, at that point, and your transformation about, going from having a heart attack to running marathons and climbing mountains. I mean, it's just an exquisite story. You were diagnosed with heart disease when you were 56. And now let's go ahead and flash forward a couple of decades. You are just now learning that even you, who eats healthfully and climbs mountains and runs marathons, you're not immune to LP little a either, are you?
No, and that's the thing. Let me just start by saying that you have a lot of a soup of alphabets. You have your LDL, the low density lipoprotein, the HDL, your high density lipoprotein, and your very LDL, very low density lipoprotein. These are all the things, alphabetical soups. And now we've got one more, and that is LP little a, or lipoprotein A. Now, what is lipoprotein A? And it is so little discussed. Nobody really talks about it, doctors as well as lay people. So your LPA or LP little a is a fatty particle that is there in the blood level carrying cholesterol, just like your LDL bad cholesterol. But the difference is that it has an extra protein, which is called the apolipoprotein A, the ApoA. This makes it very sticky, like Velcro. It becomes more inflammatory, making clots and then plaques in your arteries, so that now you are at an increased risk of getting cardiovascular disease, like heart disease, heart attacks, or strokes. In fact, if you have a very high LP little a, your chances are 3 to 4 times more of getting a heart attack.
That is exceptionally high. But, typically if somebody goes to the doctor and they have their cholesterol checked, really, to the best of my knowledge, in most cases, they're only looking at the HDL and the LDL cholesterol. How often are we tested for LP little a here in the States?
Not at all. The thing is that it is a hidden risk. It is a silent risk. The reason being that your cholesterol panels don't check it. So people, young people, are walking around with this high LPA and they are not aware of it till an event happens and they get a heart attack. Now, this can be for people who have high cholesterol as well as with people with normal cholesterol. So the whole idea is that even in my case, I came to know just about 2 years back when I was talking to my cardiologist. And I said, look, mate, I have my high cholesterol and it's not coming down. I am on statins and every other drug, but why is my cholesterol not coming down? Should we test our LP? Should we test my LPA? And he sort of was Very nice. And he was a little reluctant, but he says, okay, let's get it done. And Chuck, my results were sky high, 300.
Mm.
And the normal is less than 30. Your high level is 50, and 30 to 50 is your gray zone, is the intermediate risk. Over 50 is very high risk. So that is when I came to know. But I was lucky. Why? Because I had high cholesterol, which was not coming down. And therefore, my doctor, cardiologist, put me on those cholesterol bursting drugs. You heard of Repatha, the injectable drug. And when I got that, my cholesterol came absolutely down. My total cholesterol was 120. My 52 or something was my bad cholesterol. But my LP little a also came down 30 to 35%.
That's significant. And I think that there are probably a lot of people who are watching this right now and are probably pretty shocked to know, like, well, wait a minute, this is a really healthy eating kind of a show. It's a plant-based show, shows that, promote not having cholesterol in your diet. And yet here we are talking about cholesterol lowering medication. So can you give us an idea about what your diet actually is, and maybe that will help also educate a lot of people who are wondering about the dietary influence that might be here with LP little a.
Let me explain. Generally, a healthy diet, not necessarily a plant-based, or exercise that does not reduce your LP little a. Now, studies have been done that apart from this Repatha, you can lower it by whole food plant-based diet by 16%. And just now, Michael Greger just came out with this, that foods which are high in, like if you take a handful of almonds or those Indian gooseberries, the amla, that can reduce it by 40%. Overall whole food plant-based diet can reduce it by 16%. So we are talking about a whole food plant-based diet, and probably that, with what I'm doing right now, has saved me. My LP little a has come down quite a lot down now, and it could be due to the whole food plant-based diet too. But the sad thing is that I was lucky that I had high cholesterol, but there are people who do not have a high cholesterol. Let me tell you the story about Sandra. I think her last name is Tremolis, a 39-year-old. Because she had a very high history of cardiovascular disease in the family, she ate right, she exercised, and she went for her annual screening and checkups. Now, despite having low cholesterol, no blood sugar, blood pressure was normal, she had a massive heart attack at the age of 39. Where two of her arteries were blocked 95%. And when they found out later on and did the studies, they found that her LP little a was extremely high.
Mm.
And she did not have high cholesterol.
Wow. At just 39 years old, 39 years old, doing all the right things. And still, my goodness gracious, how common is it for somebody to have elevated LP little a?
1 in 5 have high LP little a. That is 20% of the population has high LPA. And let me tell you one other thing which I may miss out is that, remember when I talked to you last, of course you would not, but when I had my plaques and my blockages, they did on me, they put stents in me. And during the process, I had a cardiac arrest. Now, that young cardiologist, he saved my life that day. But guess what? This was 20 years back, and we did not know much about LP little a. 2 years after he put my stents, he died of a massive heart attack on his treadmill, and he was not obese. I don't know if he was plant-based or not, but he was healthy. He used to play tennis, and he died. Now, I believe, I don't know for sure, but I believe that he must have had high LP little a. He was South Asian.
Mm.
So imagine this. This has to be, but it is a very little talked about thing because we knew very little about it. But now with the American Heart Association and other cardiac this thing which are there, are now bringing it out in the open, and it is a burning topic, and now people are talking about it.
You mentioned that your cardiologist who saved your life that day was of South Asian descent. What other ethnicities seem to be at elevated risk here?
You see, South Asians, and when we say South Asians, Chuck, we don't only talk about India. It's India, it's Pakistan, it's Bangladesh, it is Nepal, it is as far as Maldives and Bhutan. All these people have increased risk of getting a high LP little a. Number two are the blacks of African descent. They have high LPA levels. Number three is recent. This is recent. Arabs have a high LP little a. People in the Middle East, in those areas, they have very high LP little a. And one other thing is that women tend to have a higher LP little a than men. And especially when during menopause, the levels go high, very high, 16% higher than the man of the same age.
Mm. And is that regardless of the woman's ethnicity? Is that naturally occurring for those, or is it?
Regardless of the ethnicity.
Okay. Wow.
Menopausal women have higher LP little a levels than men.
Wow. We have. I mean, I can't tell you how many episodes we've done on menopause. Never once has that come to light. That's very interesting. Is that new research that's coming out there?
It has been there for quite a while, because we're not saying that every menopausal woman has high LPA, but when they have high LPA, it is higher than men who have LPA at that level.
Gotcha. Okay, well, let's talk more about the nutrition side of this. I believe you said that a plant-based diet is known to lower the risk or levels by about 16%. Is that the number that you cited?
Yes.
Okay.
Yes.
And you also talked about Dr. Greger studies. Almonds perhaps have a little bit of an impact there. What are some other foods that you might prescribe to somebody who is in your position with elevated LP little a?
I would just go by what Dr. Esselstyn says. Don't go by individual things. Just have a whole food plant-based diet. Your fruits, your vegetables, your whole grains, your beans, your legumes, your handful of nuts, all these things. But as I said before, that Indian gooseberry amla has reduced by 40%. So what I've started doing, Chuck, is to bring in amla into my daily juice that I make in the morning. I make a tablespoon and put it in, and I don't know. See, the trouble is that this is a one-time test.
Right.
Because it is genetically inherited. You don't have to do it again. That's why everybody should get it done. Now, if it is a one-time test, only time that you have to do it again is if you are on the short of Repatha, then you want to see whether it has come down 30 to 35%. If you are on a whole food plant-based diet, you want to see, so you can do it to see if it has come down. Now, I have said this about the ethnicity and about your people who tend to have more LP little a. But people who have, say, a family history of high LPA, say they have a high LPA at a younger age, a family history, or a family history of people who have had cardiovascular disease, heartaches, strokes, all that, they should be, people in the family, if they have that, they should get tested. Number two, individuals who have had say, heart attacks or strokes or peripheral arterial disease, aortic stenosis, they should get it done, their LP little a. Number three, those people that familial hypercholesterolemia, whereby you cannot recycle the cholesterol and it is always very high. In this group of familial hypercholesterolemia, you get 1/3 of people who are LP little a positive. And then you have people like me whose cholesterol just wouldn't come down, even with a whole food plant-based food diet. The cholesterol I'm talking about. So I had to get my LP little a done. And then finally, you have this, if you have poor circulation in your legs, peripheral arterial disease, get it done, LPA check. But the international consensus groups recommend that everybody should get it done at least once. Now, we started, in Europe it's routine. In the US, the first official testing was done in 2024 from the National Lipid Association. From 2012, Chuck, to 2019, only 0.3% of the people had were tested for LP little a in the US.
Holy smokes. That is a very, very small number, especially considering the fact that 1 in 5 people are believed to have it, and we're only testing a fraction of the population. That's yikes. We've got some room to grow here.
But we got a lot of room to grow, and therefore it's going to be my mission now. So I'm on the American Heart Association. I'm going to talk a lot about it at every given opportunity, because I've had it. And I've seen people who have it. South Asians will call me and tell me, look, my wife has just got a massive heart attack and she's found to have LP little a. What do we do? But you are right, coming back, because I don't know enough studies are done on a whole food plant-based diet. Maybe somebody should do this. Like, our guys, Dean Ornish, he always does this fantastic things about Alzheimer's and heart disease. And I take my hat off to him. Maybe you should get people with LP little a and put them on a whole food plant-based diet along with his support groups and meditation and see what happens.
That would be interesting research for sure, to get a decent sample size and see what the effect would be. When people go to work with Dr. Ornish, I mean, it is more than just food. You're talking about a complete lifestyle intervention there. So what other lifestyle factors can contribute to elevated LP little a? Is it the same kind of things like smoking that might raise a person's risk for heart disease, like smoking, lack of sleep, lack of exercise, that kind of stuff?
These things don't matter, Chuck. Sorry to say this. What it does is that if you come to know that you've got high LP little a, then you can be proactive in your other factors, risk factors. You can start exercising more. You can start having a much better whole food plant-based diet. You can start sleeping better, 7 to 9 hours, learn how to handle your stress, avoid abusive substances, and have a robust, healthy support system. These things help, because remember, if LP little a is an independent risk factor, it is now diagnosed as a diagnosis. So, but I know it is hard because I've gone through the research of Dr. Michael Greger and other people, but I have not seen much except this one study which Michael Greger did about 16% it lowers down, and certain foods like what we talked about, almonds can help. But generally speaking, diet and exercise do not help. Now, I don't know for sure, this is what my thinking is, that even if you have a high cholesterol and it's not coming down, I always tell people that if you eat a whole food plant-based diet, you're obviously strengthening your inner lining of your coronary arteries endothelium. And therefore, it is producing the nitric oxide, irrespective of your cholesterol. Nitric oxide, that keeps the artery dilated, keeps the blood flowing smoothly, and strengthens your arterial wall so that it does not get stiff and get high blood pressure. So obviously these mechanisms may be working in my case, even though I've had high cholesterol. But I believe that one of the added factors was LP little a.
That's interesting. I just, my heart actually, kind of goes out to people who are, again, doing all the right things like eating that good whole food plant-based diet, have that robust support system, exercising, getting sleep, getting a lot of stress out of their life. They're trying so hard to be healthy and feel like, almost like they failed here in some respect because they still have this affliction. What is your message to somebody who feels completely awash at sea because they have this and they have been doing all the right things, Dr. Taher?
See, let me tell you, Chuck, very little is known about this. You've just taken the tip of the iceberg. And there is a lot of studies need to be done on this. I know that whole food plant-based way is to go irrespective whether you have high LP little a or if you have high cholesterol or not. The whole food plant-based diet is for all the chronic diseases, including heart disease and strokes and diabetes. I totally, entirely agree with it. But the thing is that there are 3 drugs right now in the pipeline. One is by Amgen, one is by Novartis, and one is by Eli Lilly. And those drugs have brought down the LP little a by 80 to 98%. But if it translates into reducing cardiovascular disease, that is in the final clinical trials in that stage, whereby if it does that, then it should be out in 2026 or 2027. Again, I wish that there was something better than medication, but as long as we are not there, then this is the hope that they have. So the idea is to at least know that you have or you don't have, because now it is proven that this thing can cause heart attacks and your strokes and your peripheral arterial disease. Now, having said that, let me tell you one other thing, which I don't know how to put this. When I went to my cardiologist, he also found that I had aortic stenosis. Now, for your people, for your they do not know about what aortic stenosis. Let me just explain. An aortic stenosis, it's by a valve. This valve, it carries the blood from the heart to the main artery aorta and to the different parts of the body. Now, if this valve gets narrowed down, then you have more pressure the heart has to apply to push the blood to the aorta. And therefore, you can get heart failure. Now, what does LP little a does is it causes calcification of the aortic valve and thereby narrows it. So once it gets narrowed, then now you have the back pressure, so you can even get heart failure. And recent studies showed that not only heart failure, but you can get atrial fibrillation. So the whole idea is that I do have aortic stenosis, but like you said, my way of plant-based eating and my exercising and my other things is probably, my doctor says, no, you don't need any valve replacement because your ejection fraction is great. My heart is working okay. Even though I have got Wolff-Parkinson-White syndrome, I have got stents put in, I've got bypass surgery, and I've got LP little a, and now I've got aortic stenosis. But I'm here.
You're there. You're smiling, my friend, and you're educating, and yeah, you're just kind of taking life as it comes. And Man, thank you so much for your time today. This has just been great. I think that you have or you will be doing a podcast on LP little a where you'll be going maybe even more in depth with the AMA. Is that correct?
Yeah, yeah, because the American Heart Association, but there's a group of people that will be there, and we will be trying to figure out what is the next step, what can we do, what is happening in this LPA field, But we
Okay.
should be doing that now. If you don't mind, let me just say that I have chosen this phrase. I made it myself. So I would like people all over your 150 countries. I have formed a phrase. Let's LPA, please let's ask. So this is my phrase. Let's please ask LPA. Let's please ask doctors, cardiologists, whoever comes, your associates, your family, your friends, your co-workers, ask them, have you got your LP little a done? Let's please ask LPA.
I like that. Let's please ask. So then I will please ask you to come back on the show again and talk more about this as research continues to evolve. We learn more. Certainly, we want to keep up to date with you because you continue to inspire, my friend. I greatly appreciate your time today.
Thank you so very much. I appreciate it. Thank you very much. Chuck, take care.
You as well, my friend.